I'm going to share 3 social listening approaches, and we'll try to be light on some jargon today. 2 approaches are technology and media dependent, and a third blends technology with old-fashioned face-to-face contact. This third approach is extremely agile, and all of these approaches are taken from work completed by Johns Hopkins Center for Communication Programs. Although I'm presenting today, there are numerous others whose hard work these slides represent. The first approach is being implemented in Guinea. This team is implementing a social listening approach that falls in line with many of the presentations that we've already seen this morning. To provide a moment of context, Guinea has a relatively conservative culture, and although internet access is growing, it's far from universal. Using AI and qualitative data coding, a review of social media content in French, English, and Arabic was implemented. Our team applied theoretical frameworks to the data and developed several key personas, 2 of which I'll mention shortly. This work is being done to drive interest in social media campaigns focused on a variety of health topics, including COVID vaccination. Within this project, we applied 2 theories that originated at Johns Hopkins CCP. My colleague will drop some citations to both articles in the chat. First, the team used the ideational theory of health communication to organize data into 3 categories: knowledge, awareness, and intent. These categorizations were later used to develop audience segments. Second, in the forthcoming campaign, we're applying the principles of bounded normative influence. This approach focuses on the role of minority communities to impact majority opinion through location, frequency, and persuasiveness of messaging. The work revealed 3 general findings. 1 is the distrust of politicians and government intervention. 2, the lack of accurate health information. And 3, a desire for localized health information, meaning the individuals want to know what services are available in their community, and they also want to know how to access those services and find locally relevant answers to their questions. Also, several population segments were identified. 2 key segments were the traditional segment, who were not receptive to new ideas or innovations, and a transitional segment, who had some information about vaccination and were more active on social media. This traditional segment shared more information, and they were often linked to many individuals in that traditional segment. As a result, the forthcoming campaign will leverage the channels of influence within the traditional segment, and the information will focus on accurate, localized health information. Based on what we know about their proximity to those in the traditional segment, we anticipate that the transitional segment will influence sentiment across boundaries. Another initiative we've been working on at CCP is the Capcovid survey and its affiliated dashboards. These dashboards present data from a global survey implemented in 67 countries. They cover knowledge, attitudes, and practices related to COVID-19 and vaccine acceptance. I highlighted the insights icon here, as this tool increases the interactive nature of the visualizations and provides data interpretation for all users, including global policymakers. To increase the utility of these dashboards, we developed user personas. Our aim was to tie each dashboard view to programmatic goals for 3 stakeholder groups: policymakers, public health officials, and WHO representatives. We developed visualizations by asking the question, as a member of a stakeholder group, what data do I need in order to implement an action? As a result, this led us to take a more journalistic storytelling approach to the data for these key audiences. RCCEs, or Risk Communication and Community Engagement Committees, are the coordinating bodies in many countries. They provide directions for COVID-19 prevention and intervention strategies. I've listed a few countries where our data have been featured in the RCCE meetings. There are others as well. Sharing these data is critical in many low and middle income countries, because they often don't have the luxury of private research firms collecting national level data. The Capcovid data has been featured in the global guidance documentation for the RCCEs. And just to show how these data trickle into national policy, it was through our Indonesian country team's work with the RCCEs and other stakeholders that the Capcovid data is featured in the Indonesian National Vaccine Communication Strategy. Social listening doesn't always have to be social media based. This next example uses more traditional communication channels and is implemented in several locations. Community listening, also referred to as rumor tracking, is being implemented by Breakthrough Action in several countries. It's important to note that although social media opens up access to millions of people, there are many people who are left out due to the digital divide. As we know, having a handle on rumors in communities is important because rumors will negatively impact demand for care and treatment. It'll damage relationships between communities and their health services. It'll enhance divisions between groups of people. And rumors that are unaddressed feed into conspiracy theories. On the flip side, what is equally as important as tracking rumors is the facilitation of dialogue and participatory planning. This line of communication must remain open, whether it's a pandemic or not. Doing so fosters trust, facilitates early reporting, and increases confidence in public health information. This slide presents one version of a community listening or rumor tracking process that we are implementing. First, community focal points are trained to identify and submit rumors via WhatsApp. National hotline workers are trained to input rumors from callers and WhatsApp messages into a DHIS2 database. Data managers analyze and synthesize data. Periodic briefs that include social behavior change recommendations are presented to the RCCE committees. And the RCCE technical working group develops messages to rapidly address the rumors. This example uses WhatsApp, hotlines, DHIS2 databases, and technology like qualitative coding. There are dozens of ways to configure this work. Locally, you should use tools that work best for the team you have. And I'll finish up with 4 summary points in conclusion. So first, social media provides key insights, but it can miss the voice of communities that are often hardest to reach. Second, data should be presented in ways that consider your users' interests and goals. Third, integrate analyses that provide meaningful audience segmentation. And fourth, develop social community listening tools that are locally appropriate. Thanks for listening today. I hope you got some of those links in the chat, and back to you, Tina.